Mr. Chairman, ladies and gentlemen, thank you very much for the kind invitation. This is the topic that has been allotted to me. I have to talk to you to European Kidney Health Alliance, abbreviated EKHA, and the decades of the kidney. And just to explain what EKHA is about, it's a Brussels-based NGO that is defending the case of kidney patients and of the nephrological community at the level of the European Union, and from there to top to bottom also in the European member states and in other European countries that are not a member. And on the right side of the screen, you see the members of EKHA. We have a number of full members. They are major societies that are involved with kidney disease in Europe. The Dutch Kidney Foundation, first of all, then the EDTNA, that's the Nurses Association, the ERA, that's the European Renal Association, the EKPF, that is the Patient Federation, and finally also the International Society of Nephrology. And next to this, we have also 22 affiliated members. These are smaller or national societies that are also a member of our group, because we want to compose an as large as possible consortium to defend the case of kidney disease at European level. So as you will understand, we are not only representing the physicians, but also the nurses, the foundations. We work also with industry if their aims are conforming with ours. And finally, and above all, we are collaborating with patients, and we very much appreciate their help and their contribution. Because the problem we are facing, and I think that's more or less international, first of all, is that there is a lack of awareness, especially in the policy world, also in the general population. As a consequence, there is a lack of funding. As a consequence, a lack of innovation. Due to that, patients have a lower life expectancy and a lower quality of life, and that takes away some of the courage to defend their case at policy level. So that again ends up in a lack of awareness and closes the vicious circle, and that is the vicious circle that we want to break. Because if you look at the key research areas for health of the European Commission, then you will find several conditions that are at the origin of chronic kidney disease, but not chronic kidney disease itself. So we want to boost research, but also a clinical application of a number of general principles. First of all, prevention, because we think that the best way to take away the burden of a disease is to make that the disease doesn't simply occur. Then personalized medicine. This is on the one hand about rare kidney diseases, but also about improved quality of life, home treatment, home dialysis, transplantation. And as a consequence, our third main topic is improving quality of life. And finally, maybe a little bit further on the horizon, regenerative medicine, the use of living cells or stem cells to supplement or replace failing organs. And to this was added a fifth focus point only recently, that is the environmental burden of kidney replacement, realizing that especially for dialysis, we are consuming per patient huge amounts of water, and that in a period where the world becomes drier and drier, there is also a huge amount of energy consumption, both in production and in application, and as a consequence, greenhouse gas production. And finally, as most of the things in dialysis are single use, then plastic waste is another problem. And this is another issue that we are very strongly focusing upon. That's the reason also why we decided to join the Decade of the Kidney, this splendid initiative from the American Patient Association, which is boosting attention and innovation in the area of kidney care in the period from 2020 to 2030. And we started initiatives in parallel at the European level. For this, we are using several aims that I'm now going to summarize to you in a minute, only a selection of them, because of course time is lacking to explain everything. But just recently we published also a paper in nephrology, dialysis and transplantation on EKHA and the decade of the kidney, and there everything is explained more in detail. But we will discuss how we are trying to reach our aims. Now, the first thing, and that is actually more or less our Bible, the basis of our activities, where everything is described, where we're working around for the last 7 to 8 years. These are these recommendations on sustainable kidney care. It's a brief document. It's only 5 pages. It has been approved by all major nephrology organizations, the ISN, the ASN, the Asian Pacific Society. And here everything is summarized that we are currently doing. Again, we have focus points, and it is more or less a repetition of what I told already. Prevention, home dialysis, transplantation, quality of life, green nephrology, and something I did not mention yet, equality, because there is a lot of inequality in nephrology, and education, which goes along with that education, especially of health illiterate, and also education of computer use and telemedicine. One of the things we are doing is trying to meet with important policymakers. Here you see pictures from a meeting with Ms. Stella Kyriakides. She is the European Commissioner of Health and Food Safety. That is the equivalent of a minister or a state secretary. So she is the major person in the European Union responsible for health. And we were able to talk to her in February 2021. She very much followed our argumentation, agreed entirely with it, and agreed also to endorse our activities and to support us as much as possible. And that is indeed what happened over the last 2 years. And I will show you a few examples in what is following. We also give a lot of attention and a lot of importance to the contribution of patients, and also stimulate patients with whom we are working to take education on how to become more vocal, to let hear their voice and explain what their problem and burden is. And we stimulate them, for instance, to participate in this online platform on patient engagement through education in Europe, which is EUPATI. And of the people here on the picture, 2 are patients, Daniel Gallego, who is the president of the European Kidney Patient Federation, and Emily Petrides, who is a vice president. We then organized a number of follow-up meetings with the administration. Here you see a picture from a meeting with John Ryan. It's a major manager of the Commission of Public Health, which is the ministry. And later on, we had also conversations about the situation in Ukraine, to which I come back at the end of this presentation. And we also try to get as much as possible into contact with the European presidency, the presidency of the European Council. You must know that in the European Union, the presidency of the European Council is held in a rotational basis every 6 months. And the last semester that ended 1st of July, this presidency was held by France. And this is the Council of Prime Ministers, first of all, but also there are a number of sub-councils along topics, and one of those topics is health. And this presidency is defining much of the activity and the agenda for the 6 months when they have the leadership. And here we were able to talk to the French Ministry of Health. We did this also together with the patients, the 2 patient organizations in France, France Rein and Rinalou, and SFNDT, which is the French Society of Nephrology. And we could get the support of the French ministry, and here also a number of initiatives were taken that were very important and which we are going to illustrate. Amongst others, they put down a roadmap for health care in Europe for the coming years. And we were able to have mention to chronic kidney disease in several times, which was actually the first time in an official EU document. We have collaboration with 23 members of European Parliament from 13 different countries. They're supporting our activities, take part in a number of our activities, and also are asking parliamentary questions. Few examples also of this later on. And we organize every year, mostly in the European Parliament, a European Kidney Forum, where about 100 stakeholders are participating and are discussing important issues related to kidney care. For instance, last year we had a meeting, in that case virtual due to COVID, on access to treatments, that is essentially equality and education. Where you can see that Ms. Stella Kyriakides was one of the well-appreciated speakers. And this is then followed by a number of press releases. There were 4 editorial pieces appearing in Euractiv, which is a major EU news outlet that is read by thousands of people that are active at EU level. And at the same time, this was also mentioned in other major platforms. A health policy platform is the platform from the European Commission itself that is announcing anything that is important in the health area in the European Commission and the European Union. Politico Europe, which is the equivalent in Europe from Politico Washington, which is a major EU news outlet. And also DOTS gave attention to our activities and were mentioning this in their press releases. And DOTS is a main EU monitoring service. And this was also followed by a number of activities on social media. This year's forum was on green treatment and innovation in kidney care, along with what I mentioned as an additional point of attention, which was very successful. And we were also extremely active at the occasion of World Kidney Day. We had, for the first time ever, plenary in the European Parliament in Strasbourg on kidney disease, a full hour devoted to kidney disease, where 7 European parliamentarians were asking questions that were responded by Ms. Stella Kyriakides. At the same time, we're also extremely active on social media. Also, this was mentioned by DOTS and Politico. We have a number of videos, amongst which also of the French Minister of Health and a number of our patients. We were asked by the European Commission to draft a joint statement on donation and transplantation, which was submitted to the European Union at the beginning of 2019. That is a text that is giving advice to the European Commission on how to increase the number of transplantations and donations. And with a network of stakeholders, we were describing 14 major key points of attention for the European Commission. And also, this was in an abbreviated form published as an article in Nature Reviews Nephrology. And this had also a follow-up with an open letter on organ donation and transplantation to the European Commission. We had also, still as follow-up of this transplantation activity, parliamentary questions asked by 2 of our parliamentarians, Ms. Jutta Paulus and Mr. Manuel Pizarro. We try also to write a number of position papers regarding important issues in nephrology, or try to contribute to position papers by other NGOs where we insert mention to chronic kidney disease where it is appropriate, because quite often there is tendency otherwise that this is forgotten. And we also give presentations. This presentation, for instance, is an example of this, and have for the time being also published 25 papers on social related issues in kidney care. The 3 last ones are mentioned here, the 2 related to the Ukrainian war, where, as you know, kidney patients are very heavily affected, but quite often forgotten. The problem is especially the need for water and electricity in dialysis patients. So one of these papers appeared in Journal of Nephrology, the other one in Nature Reviews Nephrology. There was also the paper on green nephrology in relation to the European Green Deal, which is a major European funding source for environmental initiatives. That was published in Nephrology, Dialysis and Transplantation. And not on the slide, we had also the very recent one on decade of the kidney, which came out only a few days ago. And we were also active with relation to Ukraine. That was not us on our own, but we are a member of a work group that was created by European Renal Association. And we are especially taking care of the connections to the European Commission, which is also very active in offering support. We are discussing with the European Commission the importance of taking care of kidney patients. We had a meeting on that. We had an open letter on that in March of this year, and also a meeting with the Directorate of Health in the months of June, and also participated in several other activities. Finally, we should not forget that chronic kidney disease is connected with many other chronic and other diseases, both as a cause, as a consequence. And for that reason, we are also part of this larger platform of 12 European societies that are connected to chronic diseases. That's the European Chronic Disease Alliance, the ECDA, of which we, for the time being, have the presidency and the secretariat, which offers the opportunity for us also to mention kidney disease when in the approach, the global approach to chronic diseases, we are meeting with officials from the European Commission. And often, because this is representing many chronic diseases, this offers more leverage than EKHA even to refer to kidney disease. So there is quite a lot of action required. Our main focus point for the time being are, of course, first of all, create awareness. Without awareness, no further consequences. We are heavily working to obtain a pan-European screening and prevention plan, because I think to have appropriate prevention, you need also to have appropriate screening and registration as well. Make kidney health an EU priority. As I explained, this is not the case. That's a very tough one for us. Getting access to the Directorate General Research and Innovation is much more difficult than access to the Directorate of Health. Increase EU research investment in kidney proportional to disease burden and cost, because, of course, kidney disease is extremely costly, actually the most costly chronic disease. And finally, to come back to what I mentioned already a few times, home dialysis and transplantation, which is still underrepresented in Europe. So we are using several resources indicated here in yellow. I mentioned only a few. There are more than that. The group of European parliamentarians, our recommendations, the Kidney Forum, the joint statement, European Chronic Disease Alliance, We apply a number of levers with the orange background: publications, position papers, social media, and our website. And with all this together, we are trying, and we are actually managing to influence Directorate General of Health, DG Santé, still in the French terminology. Here, this is Europe, the European Commission, the different members of the European Kidney Health Alliance, and the general public. This is what I wanted to explain to you. I thank you for your attention and the opportunity to explain all this to you.